Welcome to Health Matters, and I'm your host, Justine Ginsberg. Stress is something we all experience at some time in our lives. The American Psychological Association reports in a recent study that most Americans reported living with moderate stress, whilst 44% reported that their stress levels had increased in the last 5 years. Whilst there are certain levels of stress that are normal, repeated and high levels of stress can cause not just psychological strain, but also affect our physical health. The mind and body cannot be viewed as separate entities because they are connected and affect one another. Anxiety can worsen blood pressure and negatively affect digestion, as well as physical illnesses that can result from depression. Chronic stress can adversely impact both physical and mental health. It can increase anxiety, depression, blood sugar, blood pressure, and heart rate, and also cause insomnia. So today, to talk about all things stress-related, we want to welcome back to the show Kate Taylor, APRN. Welcome back, Kate.
Thank you very much.
I think I got stressed in that intro.
There's still more time for us to get stressed.
There is. So let's talk about stress. What happens in our body when we feel stressed?
So our sympathetic nervous system kicks in, and that is otherwise known as our fight or flight response.
Okay, that's we're talking saber-toothed tigers and...
Exactly. It helped us survive.
Okay.
So in a stressful situation, stress hormones are released, and they're named cortisol and adrenaline.
Okay.
And they send messages to the parts of the body that need to respond to the stress. So our heart will contract more. Okay. Our heart rate will go up. Our large muscles will get tight and ready to spring to action. Our senses will become more sharpened, and our eyesight, we actually dilate, our pupils will dilate. And then small airways in our lungs will dilate also, and so more air, oxygen can get to the lungs and also to the brain to help with mental clarity. All of this happens often before the stress is even perceived.
Wow.
So very quick. And then in that acute situation, we respond, well, our ancestors, and even in today, when we have an acute stressful situation, we respond to it. And then the parasympathetic nervous system is supposed to kick in, and that does the opposite. And then we're supposed to maintain homeostasis.
So that's meant to slow us back down again.
Exactly. And we'll go further into what happens there. But in chronic stress, we live in this state of constant fight and flight, fight or flight. So the cortisol keeps on being produced and tells the liver that we need more glucose. Glucose is what we need to provide energy.
And feed those muscles.
And feed those muscles and feed all of this. So in short amount, cortisol can be very healthy, and it can actually have anti-inflammatory effects. But in chronic states such as this, it has inflammatory effects. So it can then harm the blood vessels. It can then even harm brain cells.
Wow.
And so also that glucose that the liver keeps on producing will, if it's not being used for energy, the glucose is not being used for energy, then it gets stored as fatty deposits around the abdomen, which then increases the risk for heart disease and also for diabetes.
Wow, so you think about the stress levels of, so if we think about that American Psychological Association analysis, that 44% of Americans have reported that they are now living under increased stress. So people are living in fight and flight.
Right, and it's affecting our immune system.
Sure.
We're more susceptible to viral illnesses. We're more susceptible to stroke, heart attack, irritable bowel syndrome. Because one of the things you didn't hear me mention is the digestive system, because when we're in that fight or flight, nothing's really happening, or very little is. Then, and it also worsens anxiety, depression, like you mentioned.
Wow.
And a few other things too, like headaches. That's a big one.
And you think about any time in your life that you can really define as being a stressful period. Often once the stress has subsided, we always say, my God, I got sick and I've been under so much stress.
Right.
That's that reduction in your immune system.
Right.
So now you're more vulnerable.
Yep.
Oh boy, okay. So we've talked about how it affects us, but is all stress bad?
No, not at all, because some stressful situations actually motivate us.
Okay.
So it can motivate us to do a challenge, and also it can help build resilience by meeting those challenges, that in the future you can base your experience from those challenges on something else. It also helps, it can help with social bonding too. Because if you're in a stressful situation with other people, you often can have a bond with them. And then it can help with confidence even, because you've been able to accomplish something.
And you know, I often think when you talk about that stress response and how there's all this new oxygen and blood flowing up to our brain, you know, when you think about athletes and you think about performers, that increased stress just before performing, like you and I coming on television,
yes,
we're going to be much better at it.
It helps with and it helps with mental clarity.
Absolutely. As I totally messed up that introduction. So obviously my fight and flight hadn't kicked in at that point. So how do we avoid stress? Because let's face it, life happens.
Right.
So how do we avoid stressful situations?
So I don't know if we can always avoid them, but what we can do is work. So there's different ways, different things that we can do. One is we can kick in the parasympathetic nervous system, because
this is the cool down.
Yeah, this is a cool down. Because once upon a time, we would have the acute situation, then the parasympathetic system would just automatically kick in. Nowadays, we sort of have to, especially if we're living in the chronic stress, we have to kick it in, or like stimulate it ourselves. Okay. And we can do that through different activities, such as the relaxation techniques. We have abdominal breathing, mindfulness, which I know we'll talk about that a little bit more, meditation. There's also like flow experiences that you can do, that so it's being mindful while doing a task, gardening, artwork, that can help kick in the I like saying kick in, I guess, the relaxation response. And then it can also and social interactions, positive social interactions can do that too.
And laughter.
Yep, and laughter, exactly. And so with the importance of the parasympathetic nervous system, it's also known relaxation, or even rest and digest. That then helps our digestive system. So often people with irritable bowel syndrome, one of the treatments is decreased stress.
Wow.
And so then other benefits of the parasympathetic nervous system is sleep. So you get improved sleep when doing that. It helps you build your immune system.
Sure.
And more blood supply then, as I said, goes to digestive, but also the skin, the gut, and the kidneys, things that where it wasn't going with the sympathetic.
So, you know, it's interesting when we talk about this time in our lives where we seem to have an increase in stress in society, and how we really have to retrain that like parasympathetic nervous system. So really, all the things we're about to talk about are tools that we're going to ask you to think about putting in your toolbox at home, because if we can't reduce the stress or avoid the stress, we have to learn how to deal with it.
Exactly.
So Kate has become quite the expert in many of these, because it's a passion of yours.
It is, yes.
So let's start with mindfulness. What is mindfulness?
So mindfulness is based on the work of John Kabat-Zinn, who's from University of Massachusetts. Okay. And its three big components are paying attention, being in the present moment, and being non-judgmental. Wow. So it's a practice, so you can develop those, but it's also a state of being where you are in that state. And you can apply mindfulness to many activities. You can do physical activity. You can do it in when you're doing the artwork, or when you're doing gardening. You can do it when you are in a situation that is stressful. So it's like taking a step back and being the observer in the situation. And so, and I believe we're going to talk a little bit more about how we can respond to a situation differently. And so it also is used in different, it can be used in like smoking cessation and even in eating. So, but it's definitely a way to stimulate the parasympathetic nervous system.
Wow, so thinking about this tool of learning to be in the moment, how can we apply it to a stressful situation? So let's think, for example, about maybe a stressful marriage. Okay, so there's maybe a lot of discourse and arguments, and you know that Groundhog Day, you know, situation that people can find themselves in. How can you use mindfulness to help to address some of the stress and anxiety for that?
Well, one way you can use it is by seeing how you react to the situation. So you may be in the situation, it may be stressful, but how are you responding to it? And I always feel like we may not be able to change, sometimes we can change situations, other times we cannot, but when we cannot, what we can do is we can change how we respond to the situation. So, as I said, by taking that step back, and a lot of times we have a knee-jerk reaction to something. So, and that can be based on past experiences, judgment, negative thoughts, fear of the unknown, or even fear of a worst-case scenario. So, by taking that step back and looking and seeing what's the basis of your reaction, once again being not judgmental regarding it, you then can respond in a different manner if you choose.
And you know, that's so much about it. We project often our fears onto another person.
Definitely.
And then the situation can escalate. But if you think about the way you change your own behaviour, you are actually effectively changing the situation because you now have an entirely different response.
Exactly.
Okay, so
one thing I didn't mention, and I know we're going to very soon.
No, you jump in
But
there.
one of the most very important thing regarding stress reduction is being physically active.
Absolutely.
So.
And you know, if you think about, you know, often we'll say, and I know when I do a lot of work with veterans, as you know, and you know, we talk about stress and anxiety, and for them, a lot of that has to do with like a learned response due to PTS. And you know, sometimes the advice I'll give is, you know, go out and take a walk.
Right.
Go and run. Like, try to burn some of that adrenaline and clear that mind, and then come back. The conversation can wait.
Right.
The response can wait. So
And
what
that's
else?
great advice.
What else about exercise is important?
So, exercise, they're finding, and not, I shouldn't even say that. It's the Department of Health and Human Services.
Okay.
They will put out a physical activity guidelines, and the 2018, which there is a draft, is about the positive effects physical activity has on anxiety and depression. So, it can help with people who have chronic depression, and it can also help with people who may not have chronic depression but have depressive symptoms. It also can do the same thing with anxiety. It can help with chronic anxiety, and it can also help with acute anxiety, which a lot of times we have that. So that physical activity, like if you're having those moments of feeling down, feeling anxious, exactly, go for a walk, and oftentimes when you come back, and if you can take a walk outdoors, even better, because nature
Vitamin D, fresh air.
Right, and nature can definitely decrease and can decrease stress, so, or being out in nature. So then the other things that physical activity does is that moment, so that for that day, if you're physically active, you actually can improve your cognitive function. So it does wear off the next day. So really, we should be promoting physical activity every day. And if you notice, we're saying physical activity and not necessarily exercise.
Totally.
Because physical exercise is like is physical activity, but it's more of a scheduled physical activity, where physical activity can be anything. So as long as you're moving.
And you think about all the things that make people happy, taking their dogs for a walk, running, swimming, dancing, you know, things that make you feel good, and as you say, get out and about. And, you know, I think I'd like to just touch on, while we're talking about, you know, toolboxes, a lot of what we see and a lot of what you see has got to do with youth anxiety and stress. And as parents, a lot of what we can promote for our kids is to help to give them healthy coping mechanisms. So if you've got a child that's struggling with anxiety and depression, modelling that behaviour, getting outside, you know, dealing with and showing, you know, maybe we're going to deal with this after, let's go for a walk.
And that does help tremendously. And so it's recommended to get 150 minutes of moderate physical activity on a weekly basis, or 75 minutes of vigorous, or a combination of both. Any activity, there are going to be health benefits.
Absolutely.
Anything. So if you're just starting out, do something, even if it's 30 minutes, and then you can work towards the 150. Now, even greater than that, there's even more benefits, but there's very good benefits at the 150, and then the 75 are vigorous. And one of the things that's considered moderate is playing with your kids. So that and hiking, doing yard work is all considered moderate, and vigorous would be more running, swimming laps, playing tennis, playing soccer, hiking uphill.
Fabulous.
So
one of the benefits that does come from exercise is sleep.
Huge.
Tell us a little bit about not just how exercise helps us sleep better, but what sleep has to do with stress and anxiety.
So when we sleep, we will, our body heals. It's a time of tissue growth and healing, and it's a time for our brain and our body to recover. So when we are sleep deprived, it can worsen anxiety and depression, and a lot of times we're sleep deprived could be from anxiety, keeping us up at night. So it's all a circle. All of this is a vicious circle. And so by then working on the coping, finding stress reduction can help with sleep. There's a whole, we have sleep hygiene, and I know for adults it's recommended 7 to 8 hours of sleep at night. And there's something called cognitive behavioral therapy for insomnia. So it's finding those habits or thoughts that are negatively affecting your sleep, and then adjusting and changing those so that it can promote healthy sleep. So for instance, if you aren't tired, if you are trying to fall asleep, or let's say you're trying to fall asleep and within 20 minutes you can't fall asleep, get up and go find something relaxing to do. Then when you're sleepy, go back to bed. Same thing as you wake up in the middle of the night. If you can't fall back to sleep in 20 minutes, get up and go do something relaxing. It could be meditation. It could be, I have somebody who sews because they find that to be very relaxing. Reading, something along those lines, playing solitaire. Once you get sleepy, go back to bed. So then you start associating your bed with sleep. And really the bed should only be used, especially if you have trouble sleeping, for sleep and sex.
Absolutely.
No TV.
So no TV.
No, you shouldn't be reading in bed either. So if you can't sleep, get out of bed and then go back in.
And you know, the other thing, if you've got teenagers, there's a lot of research out there that tells us about the disturbance of screens. So even just the passive screen of a laptop with a screensaver, or the cell phones, that illumination can really hamper good sleep. So if you've got teens, get everything out of that room. Even digital clocks can cause disruption.
Right, and you want your bedroom to be as relaxing as possible, getting rid of the lights and the electronics. And for that last hour before you go to bed, find a very relaxing routine, almost like a bedtime ritual. And no electronics during that time, especially it's the blue light. It can affect our, it definitely affects our sleep. And then going to bed at the same time each night, having a cooler temperature. So typically 65, maybe even cool. I mean, some people may want it cooler, some people may want it a little bit warmer than that.
Sure.
But a cooler temperature can help. And so many other things, and the cognitive behavioral therapy for insomnia is not a quick fix. No. It does take time, so, and I'm sorry for people who do suffer from it, because it can be tough, because then it can make everything worse. And also with anxiety, if your mind is racing and racing and racing, I like to say a brain dump. Write it down, what's going on, before you go to bed. If you have to think about everything you're doing that day, write it down.
Fabulous. Okay, so we've talked about exercise, we've talked about mindfulness and sleep and physical activity. Let's talk about how what we eat can alter how we feel.
Okay, so when we are in that stressful situation, our body craves simple carbohydrates, the sugar, because it wants glucose.
It's those pints of ice cream.
Because it wants the glucose for energy. And then what can happen is when you have a diet that's high in refined sugar, it can worsen your anxiety and depression. So once again, you're having that cycle. So the best thing you can do is find coping mechanisms for the stress that aren't food related. The Mediterranean diet can be very helpful. They're finding that it can help reduce the risk of depression, but it also helps reduce diabetes and cardiovascular disease, which can increase your risk of depression and anxiety. Mindful eating can be wonderful for something like this. There's many different aspects to mindful eating, but one of them is so are you eating, before you put whatever you want in your mouth, are you eating because you're physically hungry, or are you eating because you're emotionally hungry? Because if you're emotionally hungry, no food is going to satisfy you. So
it's such an important thing for, again, I keep going back to our teenagers, but we're laying down patterns here for adulthood. And if you've got young children and teens, really as a family thinking about mindful eating and helping your teens to make good choices.
Exactly.
Why am I doing this?
Right, exactly. And so that's where there's a very good, and you may put it on you may opt to put it on your
Sure.
site, is University of Wisconsin has a great write-up on mindful eating and all the different cues of why we eat. And when it's physical hunger, that's when food's going to satisfy you.
Absolutely. And are there certain types of food? We've talked about the Mediterranean diet, but fruits and vegetables and salads and those types of foods give us, of course, more nutrients.
Exactly.
Which help our body to be healthier and also help our brain to be more functional and active. And
Right, and we really want to be limiting the processed foods.
Okay.
Which is not part of the Mediterranean diet.
No. I mean, I keep thinking of Mamma Mia and Greece. And I don't think there's too many.
No. It's going to be more whole foods type, minimally processed.
Fabulous. And really good fats.
Yeah.
You know, feta cheeses
Olive oil.
and olive oil. And I'm starting to get hungry.
Me too.
Okay, so we talked about nutrition. Let's briefly touch on relationships. We know that being connected to human beings is important. Mm-hmm. And we know that one of the great coping mechanisms is having another person who really understands you. Can you tell us a little bit more about relationships and how that can assist?
So positive relationships is the single most important factor for emotional well-being and longevity. So they're finding, and so that's very important. And what can happen is we have a hormone that's produced,
Oxycodone.
I know, that's what was going in my head. See, I needed mental clarity. Oxytocin.
Oxytocin, dopamine.
Yeah. So, and that hormone actually can decrease anxiety. So it's not just the physical contact that we have with other people, but it's also just the interaction itself. And they're finding that even if you have brief interactions with strangers that are positive, that helps you in the long run too.
Absolutely.
So I think just be kind to people.
That smile, exactly, be kind. So as always, Kate, believe it or not, we have 1 minute to go. Any last thoughts about stress and anxiety and how to best manage?
I think you have to find out what works best for you. Because I may say to patients, try meditation or try yoga, or try this, and they may come back and be like, I did not like that. But there's something else you can do. And there are many forms of meditation too that you can do. So it's not, so there's some that you can even be moving and you're still meditating. So that's something that I would highly recommend people to try, and especially when you're going through a stressful situation, that can be extremely powerful, is having those moments of where you feel relaxed.
Absolutely.
And this is coming from a personal space, but being in nature, that can also, taking a hike in nature, and that can also help decrease stress immensely.
Fabulous, Kate. Thank you so much again for being with us. Will you come back?
Of course.
So today we heard about stress, which although a normal part of our lives, can cause some pretty serious physical health consequences. One of the most important things we can do is to develop tools to help us manage and reduce the stress in our lives. From the practice of mindfulness to a healthy diet and regular exercise to developing better relationship skills that help us to communicate with our loved ones, and of course having an open and honest relationship with our medical care providers. For more information about the topic of stress and tools to reduce it, please log onto our website www.fvhd.org or our Facebook site FVHD. And until next time, remember, your greatest wealth is your health.